If someone were to ask me, do you know what it's like to lose a child? My answer would be no. And my heart would hurt for them. It would break for them. But there's no way I could even remotely come close to understanding how they feel in their heart on a day-to-day and a minute-to-minute basis after losing a child. The same thing, on a much lesser scale, of course, the same thing applies when you're trying to get your significant other to understand your disease. Unless someone has walked in your shoes, there is no possible way that they can know how you feel, and you can explain it, and they can see you, and they can love you, and they can see your struggle. But they can't understand it unless they've been there and experienced the exact same thing. So today we're talking about how to talk to your significant other about your disease. Now we're going to focus on hormone imbalance and thyroid because that's what we do here. But this can apply to absolutely any disease. If you're going through a cancer diagnosis and you are going through chemotherapy and you're a woman and you're losing your hair and you're losing your eyebrows and you're poofy and you're bloated, your significant other can empathize while they can sympathize. They can't empathize unless they've been there. They can sympathize and they can see your tears and they can see your hurt and you can cry on their shoulder, but they're not going to be able to heart feel it. They're not going to be able to understand on that deep, deep level how much pain you are in, how it hurts you physically and emotionally and mentally, and how you drag yourself off the couch. So we can take these extremes and we can still bring it down to hormone imbalance and hypothyroidism. But you can apply this to any disease state or anything that you are suffering with. We're going to focus on health. We're going to focus on disease today. Of course, this is very applicable to a multitude of conditions of having empathy, having sympathy for someone else, and how to talk to your loved one. Specifically, this topic is your significant other. Male, female, doesn't matter. Your significant other that you are partnered with, that you share life with, husband, wife, life partner, boyfriend, girlfriend, doesn't matter. That is your significant other that you are sharing a life with, who is living with you or seeing you day in and day out. They need to understand, well, this is how you talk to them to try to get them to understand your current condition. Okay, so let's start with hypothyroidism, right? That's what we talk about all the time on here. And we're going to talk about the main symptoms. So here you are, 9 times out of 10, you're a woman. Guys will get to you in a second, especially with your low testosterone. So hang tight. If you're a man, do not click off. You got to hang tight. My ladies, okay, you're gaining weight, right? We all know that when we start to gain weight and clothes start to get tight, and you put one shirt on, you're like, screw this, and you take it off because it's too tight, you throw it aside and you pull the next one down, and you're like, this shirt always fits nice and loose, and you put it on, and you're like, damn it, and then you take it off and you throw it aside and you're pissed off because nothing fits, everything is tight, and then that depression sets in. Then that chest feeling, that pain in your chest, that oh shit moment sets in, that you're like, here I am. I tried to fool myself with shirt number 1, 2, and 3. Now I'm on shirt number 4 and pant number 5, and nothing is fitting. And this just hurts. It's disheartening. It's frustrating. I'm pissed. I'm angry. I'm sad. I'm inconsolable. I am hating myself. I'm talking self-negative thoughts in my head. I'm going from blaming myself to blaming the doctors for not telling me what's going on, to being pissed off at my neighbor because she's skinny, to being pissed off at my best friend because she doesn't battle her weight and she can get dressed and go out and enjoy a night on the town with her husband or her boyfriend, and I can't because I can't even put on an effing shirt that isn't too tight. Are you feeling me yet? Right? I got this down pat because I've already been there. So I know how you feel. And then comes the daily fatigue, that kind of crushing fatigue where you're on the couch and you go, honey, I just can't even, like, you don't understand. I can't get up and clean the kitchen. I know there's a dish full or a sink full of dishes. I know that's your pet peeve. It annoys you. I know you hate the dog hair on the wood floor and it's gathering. But if I vacuum one room, I'm not going to be able to function the rest of the day. So I know you don't understand. I know you don't understand. But my fatigue is so bad. And then you're crying. And then the guilt sets in. Am I right, ladies? Then the guilt sets in. Then you feel guilty because you can't do what you really want to do. And you feel less than a wife and less than a mother because you know what you should be doing. That checklist that a good wife does, and that checklist that a good homemaker does, and that checklist that a good mom does of taking her kids there and taking them there and taking them to soccer and cleaning up the room and doing the laundry and folding their clothes and putting it neat and nice on the bed. So little Johnny can come home and get dressed and play with his toys, and you're in the kitchen scrubbing and you're cleaning the floors and you're vacuuming. You don't even have the energy for a quarter of that. And you wish someone would just understand. Someone other than in a Facebook group that says, yeah, Susie, I get it. Someone other than me that goes, yeah, Susie, I get it. I get it. You just wish that somebody would understand, and you wish that somebody would be the person that you're with, the person that you share moment to moment, day after day, life after life with. And then there's the hair loss. And then there's the crying and the trying to hide and the wigs and the extensions. And not that there's anything wrong with extensions. I think they're pretty kind of cool. But the hair loss that makes you sick to your stomach, that makes you cry every day. And ladies, listen, I know when it comes to weight and your hair and any kind of breakout, it literally ruins every part of your day. It's like you get so hyper focused in your mind that you can't work. You're like sick to your stomach when you start to try to work. You don't want to go grocery shopping. You definitely don't want to go clothes shopping. My God. You just don't want to do anything. Your friends call like, hey, Jane, you want to go out and get a drink? No, I have a webinar I have to be on tonight. Lie. You just don't want to get dressed and go out. And you don't want to go out. And you're going through this in your head, right? I don't want to get dressed and go out because I don't feel comfortable in my clothes. It's going to make me sick to my stomach. I'm going to become more depressed and more frustrated. And then I'm going to go out and be faced with food that I know I shouldn't eat because I'm already 20 pounds overweight. And that's just going to put pressure on me. And then I'm going to be pressured by my friends to eat the food that they're eating, but they can't eat the food that they're eating and not gain weight because they don't have a thyroid problem. They don't have hormones that are out of control. So then it piles on and piles on and piles on. It affects every single part of your life and every single day of your life. And yes, number one, you do need to get help, and you need to work with somebody that knows the thyroid and knows the hormones and that can fix you and give you your life back so you don't have to keep on in this cycle. But today we're talking about talking to your significant other to get that support at home. Now, in my patient experience, I have seen both sides of the coin. I have seen the extreme of zero support, and I mean zero support from the significant other. Flat out does not understand. Says you're being lazy, just get up, get off the couch. What are you doing? It's all in your head. You got a problem. You're going insane. What are you talking about? Just eat less and exercise more. So now your significant other starts to sound like your freaking doctor that you want to punch in the face because nobody's giving you answers. On the other side, I have seen tremendous support. That loving, caring, empathetic, sympathetic, honey, We will do whatever it takes to get you well. You are my rock. You are my life. Let's do this. Whatever it takes, I'll drive you there. You can't drive, you too tired? Drive you to your doctor's appointment. I'll drive you 3 states over. I'll put you on a plane. I'll give you the money. We'll buy you the supplements. We'll buy you the hair extensions to make you feel better. And I'll hold your hand the whole time. That's the other extreme. 9 times out of 10, people are going to fall in the middle. They're just going to question because they don't understand, especially if you are with someone who is relatively healthy, who has never been really, really hit with a health crisis. They might have seen it. You might be saying, well, Amie, but my husband saw his mother, go through cancer and go through Alzheimer's. And so he knows disease. No, he didn't experience himself. He did not experience it himself. It is one thing to see someone else go through a horrific disease. I've seen my dad go through cancer. I saw my mom die of Alzheimer's. I still don't know what it's like to be in my dad's shoes as a person who went through chemotherapy twice, as a person who is a life partner with someone who becomes a child. I don't know. I can only see it from my perspective. Your significant other can only see it from their perspective. So you have to, in order to get them to even remotely come forward and understand, this cannot be a shouting match. This cannot, and side note, I am not a psychotherapist. This is just coming from experience. This is coming from my own experience, and this is coming from the experience of working with so many, many patients throughout the years. So many. 25 years of doing this, kids. I've seen a lot. You have to bring that, you have to meet that person where they are, and they really have to meet you where you are. Now, you don't have control of the other person now, do you? You only have control of yourself. So you only have control of how you present this information and what you use to get them to understand. They see your pain. There's no doubt they see your pain. And I'm here to tell you that they might not ever 100% understand it. And there might still be thoughts going through their mind that you just need to get up. You just need to eat less. But you can't change their subconscious programming. You can't change that. That's on them. All you can do is try to get them piece by piece, nibble by nibble, get them to understand how you're feeling and how much feeling better means to you. And then we're going to connect it to what it means for them. Okay, so of course we always start out, well, we just want to be understood. We want that person in our life to have some kind of understanding, to say, wow, I get it. I hear you. I can't imagine what it's like to experience X, Y, and Z, to experience that frustration that you can't get dressed, to experience that crushing fatigue. And honey, I don't fault you. I don't blame you. I know it's something going on inside of you, and that's what you want to hear, but that's not what you're always going to hear. Now, in a perfect world, right, 2 people would communicate this way. And I'm sure there's a counselor out there, a couples counselor going, or a communication counselor going, yes, that's exactly what we teach our people. This is how we communicate with each other. Kudos. I don't have that skill level. I'm coming from real life here. So I know I want to be understood. I want to be able to speak, and then that stereotypical communication piece that we all hear of repeat back to your partner what they just said so that they feel heard and understood. That's what we all want, but we don't do it. Do you do it with your spouse? Do you do it back to your husband when he's like, damn, baby, I had a really bad day. I had this happen and that happen. And or are you still just sitting there, you're cooking and you're stirring? Yeah, okay. Wait, can you get Johnny dressed for soccer? He doesn't feel heard either. You got to give to get. So there has to be a 2-way street here of communication and some level of understanding. So you have to practice with him a little bit of the understanding that you want back in return. So start with changing yourself. Start giving a little bit of understanding, repeating back to him what he says to you. Mundane, not mundane? Is he pissed off that he missed his golf game? Is he pissed off that it's raining and he can't golf? Is he pissed off that his boss made him work overtime? Is he pissed off that he has to work on the weekend? Repeat it back to him and come towards him with some kind of level of understanding. Okay, then maybe over time, right? Because when we change, other people change. Maybe over time, he'll throw a little bit back at you. Part two is, as you guys are meeting somewhere in the middle, you are going to do your best. You can't rely on visual. You can't sit back and go, well, he sees me laying on the couch all day. I tell him I don't have energy to get up. He knows I've been to Jenny Craig and Weight Watchers and spent all this money on all these different programs and online programs and Beachbody and Shakeology and this diet and that diet. And I got 10 diet books lined up on the bookshelf. He knows I'm trying. It's not a visual kind of thing. He can see all that. It's not going to come together in his mind to go, oh, Jane, you're suffering. You're suffering really bad because you've been the Weight Watcher and you spend a shit ton of money on all these diet programs and you got a bunch of diet books and I see you buy diet foods and you know. No, he doesn't know that it's something going on inside your body. He doesn't know that it's hypothyroidism. He doesn't know that it's your hormones going wacky. He just thinks that you're epically failing at every other thing that you buy. You have to come with some kind of level of understanding and get him and sit him down and say, honey, I want to explain something to you. This is what and keep it brief. This is what I have tried and it's not working. So therefore, biologically speaking, and everything that I've learned on the Thyroid Fixer podcast, I know that something is going on in my body. I have learned to listen to my body and listen to my body's signals and not accept what Dr. A, B, and C have said that I'm normal because I know I'm not supposed to feel this way and I know I'm not supposed to be like this. So I need you to try to understand that it's not my intention to be lazy. That's not who I am. You know who I am. I'm not a lazy person. I want to get up and do the cooking and the cleaning. I like it when I do that. I want to get out in the garden. That brings me joy. That brings me peace. I want to take care of the kids. But when I do, I get hit with this level of fatigue that would be like you playing 10 rounds of golf in one day. Imagine how fun it would be in the beginning and how tired you'd be at the end. It'd be like you playing back-to-back 3 college football games. Remember your college football days? Yeah, that's what it feels like at the beginning of my day. That's not even the end of my day. That's the beginning of my day. And honey, you know that I take care of myself and I try and I've been researching and I've been listening, but there's something going on because, and you can do to him what I did to my doctor 25 years ago. Here's my diet. Here's what I eat in a day. So if you look this up, you'll see that my body should not be gaining weight. I should be losing. I should not be gaining. That's kind of part one, right? That's part one in the coming together to understand and gaining some level of understanding on his part. Keep it brief, keep it short, keep it impactful. So as you are giving a little bit to him in repeating back to him his hard part of the day, and I don't care if you're sitting there going, that's nothing compared to what I go through. I'm not going to give him, honey, I'm so sorry you missed your golf game today. Amie, are you kidding me? I'm not going to give that to him. Missing his golf game is nothing compared to what I'm going through. I get it. I get it. You're comparing though. You got to stop comparing. You got to stop comparing yourself to your neighbor and to your best friend and your girlfriends. And you got to stop comparing yourself to what your significant other is going through, because everybody has a pile of shit. It's just their pile of shit is different from your pile of shit. And that's the bottom line. But everybody has a pile. You can't go through life without a pile. So you have to come to him with that same level of understanding that you would like in return. And then you have to tell him how important this is to you and what it would mean for him. So bottom line, right? Happy wife, happy life. If you feel good about yourself and you're more confident in your skin, what does he get? He gets a date night. He gets to go out more. You guys get to do couple dates, and he gets to hang with his buddies while you hang with your girlfriends. He gets more sex because and this is a big one. Just play that one. Use that alone. You feel comfortable in your body. You feel more comfortable and confident in your skin, and that exudes out of you. And that exudes out in the bedroom, and that exudes out in the day-to-day. And he looks at you and goes, damn, you're looking hot. Maybe you only lost 5 pounds, but you took the steps, right? You convinced him to say, honey, this is important to me. This is very, very important to me to get well. This is important to me to not feel the way I do right now. I need my body back. I need my life back. I need my energy back. I need to feel like how I felt before this disease took over. Because I am not my disease. I am Amie. I am Jane. I am Mary. And that's who I want to be. And you, my dear, will get repaid tenfold, because you're going to have a wife that doesn't bitch at you because she's snippy and snappy and her hormones are all over the place. And she's dealing with hot flashes and not sleeping. She's dealing with an extra 2 pounds every single day she steps on the scale. She's dealing with clumps of hair in her hairbrush and in the bottom of the shower. That's making her really, really bitchy and crabby and snappy. And the last thing she wants to do is cook you a dinner, take care of your kids, let you go to golf, let you go out for boys' night because she's not staying home taking care of the kids while you go have fun because she's too damn fat to get into any clothes to go out and have fun herself with her girlfriend. So if she can't go out, you're not going out. And you're not having sex either because she's not getting naked because she doesn't feel good about herself. The rewards are tenfold for him, and that's how you have to present it. What's in it for me? What's in it for him? People always want to know what's in it for them. You want to ask a favor? Well, yeah. Okay. What's in it for me? We're not getting into, the integrity part. You should do things for other people. Yes, you should. You should do things for other people without expecting something in return. However, most of us are driven by what's in it for me. If I'm going to give you time, if I'm going to give you money, if I'm going to give you effort, what's in it for me? So if you're asking your husband, significant other, boyfriend, men, just hold on, we'll get to you. If you're asking your husband, honey, I need to, go find somebody like Amie, like Dr. Amie on Thyroid Fixer podcast to work with, because she's going to give me my life back. And she has like 99.9% results. She can't say 100, pretty much has 100%. But I really want to work with her because she makes people better and gives them their life back. And I know that if I can get back to feeling like me, you will benefit tenfold, XYZ. Here's what you get. Here's how it benefits you. So now you have a little bit of understanding, but you've also presented it in terms of what's in it for them, because that's what it comes down to. So there's that level of understanding and empathy that you desire, and I understand that, and I get it. And that will occur on a certain level. Remember, you're going to give that, even if it means understanding about golf or working late. Over time, as we change, other people around us change, because we are exuding something different. We are behaving differently. We are tipping them off center, so that they actually respond to us differently. It's the whole law of attraction, magnetism, vibe. You're putting out a vibe. We always say that, vibrational energy, the whole deal, everything. Joe Dispenza, The Secret, everything rolled into one. It's basic logistic truth. When you change, which is the hardest thing to do, when you change, other people change around you. You got to be consistent, though. You can't do it once and go, well, that didn't work. You were wrong, Amie. I did. I came to my husband and I said, I totally get it about your golf. And I reverberated back to him his own words, just like you learned in the couples communication manuals. And it didn't work. He still doesn't understand my hypothyroid symptoms. He doesn't get it. Keep doing it and be consistent. And then other people will change around you. And then what are we going to do? So we're going to be consistent. We're going to give him some attention that we want, you know, the understanding, verbal understanding, right? Repeating back the frustrations, as minor as they may be. We're not going to compare. We're not going to compare our frustrations. We're not going to play whose hell is hotter. We are not going to play whose hell is hotter, because everybody has a pile of shit. Remember that. Nobody's hell is hotter. Everybody has a pile of shit. Keep that going in your mind. Post it on your phone. Put it on your fridge. Keep everything in perspective. Do not compare. That goes for your best friends and your neighbor too. Don't compare. And then we are going to present a couple key pieces of how we feel and how we know it's not right. It's not us. Something's going on inside. Don't have control over it. It's not lazy. It's not lack of, it's not that you're not dieting enough or exercising enough. And then you're going to present of what's in it for him. And there you go. Now you have a little bit more support than you had before. And there's no fighting, and there's no battling, and there's no lying, and there's no spending money behind people's backs. It's just the presentation. Because a lot of people are in a commingled situation. A lot of people do have a shared income or shared accounts where you can't make a big financial decision or a big life decision or a big investment in yourself without consulting the other person. But in order to get them on board and even to go through a transformational journey, you're going to need that little bit of support. Can you do it without support? Sure. I mean, I know me, I'm the type to be like, hey, this is what I'm doing. I need to get better. I'm going to spend money. I'll catch you with or without your support in 5 months, and you'll see a different person. Not everybody's like me. I'm kind of a bull in the china shop, if you haven't noticed that yet, but very blunt and just hard-headed. So I want what I want when I want it, and if it means me feeling better, I'm going to get it, with or without your help. But not everybody's in that situation. Some people got to talk about it. If you got a family of 5, you got to talk about finances. In order to make a big financial decision, in order to make an investment in yourself, in order to buy freaking supplements, you have to sometimes talk about it. Like, listen, honey, I need, a couple $100. I'm going to go over here and buy this, and I'm going to grab some extensions too. You got to have that talk, that communication. Men, it's a lot easier for you because women are way more emotionally available. Now, men, if you're talking to another man, if your partner's another man, you might have to use a different approach. You got to have to blend the female advice with a little bit of what's in your gut instinct of how you operate in your head, because men, you just operate differently, right? So here's the deal. Man, you have hypothyroidism or you have low testosterone, high estrogen. If that's occurring, you're not going through the same mental beat up that we are. You're going through this. You're going through, God, this sucks. I don't feel like a dude anymore. There's so much pressure to have sex. The guy always has to perform. Why are we the one that has to get the hard on in order to perform? Oh, there's so much pressure. I want it, but I don't want it. I feel fat. I got this big belly. I can't even get the energy to go golf with my buddies. I don't want to go golf. I feel like crap. My boss is pissing me off. Kids are pissing me off. My wife is being a bitch. All she does is bitch at me all day long. Nag, nag, nag. I got to get stuff done. I don't feel like it. I don't have the motivation. I don't want to go to the gym. Gym is stupid. Just a bunch of meatheads at the gym anyways. I'm just going to sit home. But I don't want to sit home. I don't want to watch TV. Game of Thrones is stupid. Why am I sitting here? That's what's going through your head, right? You can't figure out what's going on with you. And the truth is you just have high estrogen and low testosterone. Nobody's helping you because your poor testosterone's coming in at a 350 and nobody's telling you that that's way, way, way too low. They're telling you you're normal. And since hypothyroidism and Hashimoto's is more of a female disease, although it does affect males, it just affects females a little bit more. You're getting blown off because you're a guy and nobody's testing you. So now you're trying to explain to your wife, she's taking it personally that you don't want sex. She's taking it personally that you're saying that sex isn't that important. Why are we having sex and that? It's not on her. It's not on you. It's inside your body. You got to get your testosterone checked. If you have low testosterone, you're not going to be able to achieve an erection. You're going to have a little bit of erectile dysfunction. You're not going to want sex. And you're going to be a little whiny, crabby biatch instead of being the man that you are meant to be. And your wife is going to go, what's wrong with you? What's with your attitude, Johnny? I don't get it. And then she's going to slough off on a corner and think it's all her fault and be beating herself up in her mind. But she's going to be presenting to you that she's just naggy and bitchy. But really she's sad because you're sad, because we are emotional creatures and we hurt when you hurt. You guys got to come with some kind of understanding. Now, you as a man have to take that first step to take hold of your health. So the women over here are going, I want to do something. And you guys over here are going, I'm not going to no doctor. I don't want somebody testing me. I don't want to know what's wrong with me. Men, you have to kind of just come from here, this line, like just a little bit further over in order to reach that point where you say, okay, I know my body and I know how I'm supposed to feel. This isn't right. I need to take that next step. And that's where you come to your significant other and say, honey, I'm just not feeling like myself. That's all you have to say to a woman. And that's the tone that you have to use. And she'll go, oh my God, what can I do? What can we do? What do you need? You need to call somebody? You want me to call somebody? I'll make the appointment for you. I'll draw the money out of the savings account. What do you need? I want you to feel good, honey. I want you to be the best father and the best husband that you can possibly be. And I want you to be the best work. I want you to have that confidence and be strong because you're my man and you are strong and you are the head of the family and you're awesome. And that's what we think. Don't give me the female, like, I'm not saying that about my man. I'm the head of the household. Listen, I get it. Everybody's equal. I get it. But truthfully, ladies, in your heart, you are looking at your husband, your significant other, your partner in life as elevated. You're looking at them with admiration. Whether you're a female looking at a female and that's your partner, you're looking at her with admiration. If you're a female looking at a male, that's your partner, you're looking at him with admiration because you love them and you put them on a pedestal or you wouldn't be with them. And you want that person to feel their best. So don't let female power or male power or feminist power get in the way. The bottom line is that you feel in your heart that you love that person and you want to understand them as much as you want them to understand you. Talking to your significant other is hard to get them to understand your health. I have heard people say, now this comes right from a patient, right? I've had a patient say to me, my husband said, why don't you just go off that medication? You don't need it. Her thyroid medication. And of course, her and I laugh. We go, he doesn't know what would happen if you went off that thyroid medication. He doesn't understand that you would probably gain 20 pounds and be on the couch. And this is after, of course, we got her optimized, right? You gain 20 pounds, you'd be on the couch, you'd be miserable, your hair be falling out, and you wouldn't touch him for about 2 months and wouldn't even care about it. And he thinks he's all right, you don't need that medication. But it's about understanding. So once her husband saw the dramatic difference of who she was versus who she became, which is actually just her own health and who she actually is coming out. It's obtaining that optimal life. It's getting back you. It's becoming you again. Once she obtained that, he was like, oh, hey, damn, baby, you're not ever going off that medication. You want some more? Here, I'll go to Mexico. What do you need? We'll get you your medication. $200 copay, not a problem. Not a problem. We're going on vacation. Honey, you pack that medication because I want you going without it. And I'm not talking an antidepressant. I'm talking about thyroid medication and a little bit of progesterone and maybe some testosterone for you ladies. And guys, I'm talking about testosterone for you and maybe a little bit of thyroid medication. Just to feel your optimal self. And then there's all the little stuff that we do underneath. Yes, of course. Yes, there's the dietary changes, and then there's the supplements, and there's the testing and the co-infections, and all those things we do to heal you naturally, but I'm using that as an example of when someone was optimized after being put on the proper amount of or the proper type of hormone therapy, whatever that might be. Their significant other was like, wow, okay, I was wrong. There's a difference. That's a lot there, isn't there? So in talking to your significant other, I know this is a controversial topic, but I think it's an important one that nobody really talks about. Nobody talks about enough in our thyroid community, in our messed up hormone community. Nobody talks about actually sitting down and getting that other person to understand. And then there's getting your boss to understand. There's getting your coworkers to understand. And they're getting your friends to understand. And that will be a totally separate podcast. This one is a big one. No matter what disease or health condition you are dealing with, it is tough to get that other person to truly understand. And they might not ever understand because they're not walking in your shoes. But if you can change it 10%, 20%, 30%, wouldn't that make your life easier? Wouldn't you feel more comfortable having that support to just say, okay, I can do this because I have that little bit of backing, that little bit of, it's okay, honey, that pat on the shoulder, that knowledge that, listen, babe, I don't understand. And I might never be able to feel what you're feeling. I can see it. I can see it in your eyes. I can see it. But I might not ever feel it. But you have my support. No matter what you need, you have my support. And you can do this. And together as a team, we're going to do whatever it takes to make you happy, because you happy makes me happy. Because I love you and you're my partner and I want you to be happy. So let's do whatever it takes to get you there. Sometimes hearing those words takes some work. It's going to take some work on your part too. Hopefully I gave you some nuggets from a very non-psycho-babble perspective, just some personal experience and patient experience, and 25 some years of talking to thousands of people. Do this with a significant other and go from one extreme, or be at one extreme and be at another extreme. And then most of you are just in the middle. If you have any questions at all, you reach out to me. If you're my patient, we can work through this. We always do. We always talk about this, right? It's a key component in wellness and health. And if you are still on that struggle bus of saying, well, okay, now I have my partner's support, now I need to just get my life back because I'm sick and feeling this way. And you nailed it, Amy. You nailed it when you said everything that you said about how I feel. Just reach out to me. I will take your hand. I will get you there. This is easy for me. My message to everyone is, this is easy for me to work with you and get your life back. You just got to trust me and give me a chance. And then we'll get you there. I can promise you that.